Well, Omicron has now been found in at least 17 states, including Missouri. Now that the Omicron variant of COVID-19 is in St. Louis, how will we track it? That's the question doctors are discussing right now. And the answer might be easier than you would expect. Friday, leaders announced the first case of the Omicron variant in St. Louis City.
It was found in someone who recently traveled within the U.S., but not internationally. 5 News Side's Tracy Henson learned more about how Omicron is being tracked. And Tracy, what do people need to know about this latest variant?
Okay, so there's a lot we don't know right now. The CDC says it will likely spread easier than the other variants, but we don't know if it is more dangerous. Now that's why Dr. Rachel Charney, director of the emergency preparedness at Cardinal Glennon Children's Hospital, says tracking it is very important.
It's good to know what is prevalent in your community and what's driving your surge forward.
Identifying a virus variant allows scientists to take a closer look.
Whether they introduce any new variables into this pandemic, are they more transmissible? Are they more severe? Do they escape our vaccines on any level? So understanding those things allows us to adjust our response.
Adjustments like how patients are treated and how further transmission can be prevented. For now, Omicron data is limited.
We don't have as much information as we'd all like to have already on the Omicron variant, but that for now it's still the Delta that we're dealing with in the United States.
Tracking Omicron once it is more prevalent might be a bit easier than tracking Delta. That's because some common PCR tests are able to pick up the variant, significantly shortening the lab time.
That's a unique finding. Certain PCR tests have a marker on them that goes along with the Omicron variant. It's not across the board, and not every testing group has that ability.
Dr. Charney says most variant testing is done by determining the entire genetic makeup of a COVID cell.
It's a very time-consuming process, so we do it usually on a collection, and that's the surveillance work that's done at the Department of Public Health, at the state level, and at the federal level as well.
Whatever the variant might be, one thing is clear: COVID cases are surging in the St. Louis area. There are 374 COVID patients in the region's hospitals right now. Dr. Charney told me she expects to see a rise during cases during the holidays.
Tracy, thanks. New travel